have something I'm passing out to you that pertains to the research project that I did over this semester. So what I decided to focus on was improving the success of interpreting events at Downtown Health Plaza in Winston-Salem, North Carolina. And this was inspired through my internship that I participated in this semester. So very briefly, we're going to go over the contents of my presentation. One, the background information of Downtown Health Plaza, the particular research question and hypothesis, the materials and methodology that I used in order to create the information leaflet, the results, as well as the limitations and further research, bibliography, and the acknowledgments. So just a little bit about Downtown Health Plaza. It's a primary healthcare facility located in downtown Winston-Salem, North Carolina. They house a pediatric wing, OBGYN, adult medicine, and a pharmacy. And then they also serve a large population of Hispanic men, women, and children. And so just a little bit of statistical facts, percentages. 65% of LEP or limited English proficient Spanish-speaking patients are in pediatrics. They serve 50% LEP Spanish-speaking patients in the OBGYN and 11% in adult medicine. And they're also a patient-centered care model, which means that the patients and their families have more say or are more involved in the decision-making process of their treatment and care. Okay, so from my observations at Downtown Health Plaza, I wanted to see what was an issue that I could address. And so the research question, it seemed that resident physicians in particular didn't understand how to work well with an interpreter. And so my question is, what would be a beneficial resource for resident physicians to improve interpreter interactions at Downtown Health Plaza and increase the success of interpreting events? And so I proposed that an ad hoc information leaflet providing practical steps to improve interpreter interactions would help to increase the success of interpreting events. And I had went over a lot of reasons for this, why not training sessions or posters or other things like that. Currently, they don't have training sessions, but unfortunately, medical residents, there's not a lot of time for them during the day, so it would be incredibly difficult for them to have like a 1 to 2 hour information training session during the day, and the information leaflet as well. It would be a simple design, easily readable, accessible. You can take it with you and read it on the go, essentially. So what were the situations that I observed while I was at Downtown Health Plaza, and these were what were incorporated into my leaflet. So this is lack of awareness in time, lack of awareness in the resident physician's actions, and failure to establish the interpreter's role. We're going to go into each of these. So awareness in time. This was incredibly important because my observations showed that they were not aware of the time. There are studies that show that LEP patients and interpreting events, it usually takes between 5 to 10 minutes longer than an English-speaking patient, which is normal. However, medical residents at the facility would take even longer than that. And so for medical interpreters, extended periods of time could be hazardous to the interpreting event. And why is that? And then based on the picture here, warning, contents under pressure. So interpreting is an increasingly difficult but mentally as well as physically exhausting event. So it's suggested based on literature that interpreting beyond 30 minutes at a time can affect the interpreter's performance. And my observations showed the interpreters, there was one in particular with a Russian medical resident. She had the interpreter there for between 40 minutes to an hour, and that was an incredibly long time for that. But what I saw was that she became physically exhausted. She needed to sit down. There were longer pauses in her interpreting. And she had to repeatedly ask the physician and the patient to repeat what they had said in order to interpret. Okay, so the resident physician's actions. There were two particular things that I saw, and that was that physicians would speak in third person, or they would go back and forth from speaking first to second to third, and then they would also face the patient. They would face the interpreter as opposed to speaking to the patient. And why is this hazardous? Because it definitely decreases the interpersonal care that you see with your patients, and that's incredibly important. And so also inadvertently, by facing the patient instead of the interpreter, you can pick up on nonverbal cues that you see that could possibly help in the diagnosis of the patient. For an example, for speaking in first or second person, the physician, instead of saying, please tell the patient that, that she needs to use this cream in order to reduce her rash. Instead, you need to face the patient and say, I believe that you need to use this cream in order to reduce your rash, and that also increases interpersonal care. Okay, lastly, failure to establish the interpreter's role. So there are many studies that show that it's most definitely important to establish the interpreter's role. And what I found at Downtown Health Plaza is that failure to do so can cause confusion and lack of understanding for the resident physician. So for the confusion, there was one example where, let me go over the three roles that I described, I'm sorry. But there are a lot of roles that an interpreter can play, but what I found was that mostly it was the neutral conduit role, which you just relay messages without omissions or additions. And then I also found the cultural mediator role, which you specify or explain to the patient if it's culturally specific and necessary to further the consultation. And then the last one is the patient advocate role, where you speak for the patient if it's needed. So in ways in which it can cause confusion, there was one physician that I lost my train of thought. I'm so sorry.
Was it the cultural example of the food?
No. Ways in which can cause confusion was in the cultural mediator role, where the interpreter had to explain something that was culturally specific, mainly to like thyroid and taking thyroid medicine. But unfortunately, the patient was wanting to go to like a healer or use home remedies instead, or like she just wasn't aware that taking thyroid medicine, it was necessary for her survival. She had hyperthyroidism. Anyway, so in that sense, the interpreter had to explain this, but the physician became very frustrated, didn't really understand what was going on. So that's a reason confusion could occur. And then also in terms of understanding, again, it could help to improve interpersonal care. Okay, the material and methodology I used was Microsoft Word 2010. This was in order for me to easily navigate and take advantage of the templates that were used. And then this is the particular content of the information leaflet that I have. So I have opening remarks about Downtown Health Plaza. Be aware of time, be aware of your actions, and be aware of the interpreter's role, as well as the contact information of the researcher and facility. So what I did in order to test the readability of this information leaflet was the Flesch Reading Ease Readability Score, and that was created by Rudolf Flesch in 1948, and this is widely used in the United States in order to test the readability, and because it's pretty accurate. And so I just used the manual formula as well, and it's just a simple formula. You plug in the average sentence length of words into ASL, and then the ASW, the number of syllables per word, you just plug it into there. I did that manually, and based on that, I fell within this range. Right here was about 49. So that suggested to me that it was easily readable, especially for resident physicians, because they have to have more than a graduate degree. The results, so the information leaflet was created so that it's simple in format, it's easily readable, it's accessible, and it's always on hand. And then again, I'll stress that the Flesch formula suggests that it can be easily read by either high school students or college graduates. And this was just a larger close-up of the information leaflet that you have on hand. And so just one thing I want to point out is that difficulties within making the leaflet was making it very concise information, because there's a lot of information you can tell a resident physician, but obviously that's not their field of study. So it needed to be concise and to the point, and to get the point across so that they can improve the success of interpreting events. And so this is the other side of the information leaflet as well. Okay, conclusions. In order for residents to understand and improve in interactions, an information leaflet was created based on the situations assessed. The design of the leaflet was very simple. It's very customized to DHP, easily readable, accessible, and always on hand. And the flash readability score suggests that residents will, in fact, be able to understand and read the contents. So there were a few limitations to the study. So the data that was collected were based on my observations at Downtown Health Plaza, as well as an extensive literature review. But also the situations identified in the leaflet are also specific to Downtown Health Plaza, so it can't be generalizable to other facilities in Winston-Salem or North Carolina. And this information certainly does not take the place of any training or other resources, but it's a supplement to anything that might be used in the future, hopefully. And then also with the analysis of the reading flush score, the number of sentences and syllables I calculated manually, so I didn't do any analysis on any margin of errors. So further research, my hopes would be to distribute this information leaflet to Downtown Health Plaza in the hopes that it could be suggested to be used there at the facility, and also probably doing a survey or some other form of research to measure its effectiveness. And then further research on the actions of medical providers in interpreting events, I feel that needs to be necessary, because there's not a lot of information in interpreting studies on residents or physicians in that matter, and how they affect the interpreting event. And it's also suggested that training in medical schools to learn how to properly work alongside an interpreter should be required, especially through just talking with the resident physicians. It seems that they don't have time really to go through this training when they start their residency. So doing it in medical school would be the most beneficial resource. Okay. And just acknowledgements. Guy Professor Cabrera, thank you for advising me, Professor Sally Barber, for your proofreading, and to all of the interpreters, resident physicians, administrators, and staff at Downtown Health Plaza for allowing me to observe them, and also my friends and family. Thank you very
much. We'll go ahead. I had a quick question. That was when you said that this was applicable. It's very handsome, by the way.
Yeah.
When you say it's applicable just to this location, do you think that you could think of a template that you could prepare for others in other places so they could do the same thing for their specific area?
Yeah, I think so. I think that one thing would be just to address the issues, and then go through specifically of what specific issues for each one, each category.
Go ahead. Yeah.
No, I was just interested because you would like to know how this is going to change things, right?
Mm-hmm.
So and that's, of course, you pointed out as future work. But is there a chance that you could look at other types of programs where people do certain things like this in other domains to see what you expect in terms of leaflets, how a leaflet can contribute to promoting certain things? I mean, I think you could probably get some sense of it, and probably. I don't know if you've thought about this leaflet program by simply having observed the effectiveness of something like this in other domains.
Yeah, no, because I didn't really go into looking at other domains about how leaflets could be effective in that, but I definitely think in the future that would be great to continue.
Well, not even just in the future, sure, but I mean, but as a benchmark for having some idea of if it's more effective or less effective than you might expect in some way, right?
I'm a member of the medical field, and like she said, the doctors are diverse now. They're not all from the United States. Mm-hmm. So they're double interpreted, where they themselves may not understand what the patient's trying to say. And the interpreter has to get the point to the patient, what is my doctor trying to say? Mm-hmm. Because we have the same problem on the other end with the doctors. Sometimes they say things that in another country means totally different than here in America. And so what Kayla has established here would be great for us nurses and other healthcare professions. Because we have a hard time trying to get across to the patient what we need. than to do.
There are different layers
Yes.
of all this.
And this would be a great program, especially for those new doctors we get from Kenya and everywhere else.
Yes.
And then-
Congratulations. I like this resource a lot.
Thank you.
And, well, I wouldn't say that your conclusions or this part cannot be generalizable. I should say that might not be generalizable.
Might not.
First of all, because you are using a reasonable methodology based on bibliography and further research. So you're basing your research on a very credited methodology, let's say. And on the other hand, because what your conclusions here and your observations reflect what might be happening around in different settings in this interaction, patient, interpreter, and provider. So I would say that they are perfectly applicable in other contexts. They might not be generalizable at all in 100%, but I would say that in a high percent that would be generalizable.
Thank you.
Sure.
Just quickly, and it's related to that, I just want to commend you on this research because you've made a bridge from something that is kind of theoretically based into an actual application, and that's a wonderful outcome to come from a project, and to have something as beautiful as this that you can actually take down there and hopefully improve the lives, as we heard, of the nurses, the doctors, and then also the patients. That's a tremendous contribution, so you
Thank
should
you.
be very proud.
Thank you. Yeah, I thought it would be a very practical perspective.
Yeah,
and-
that's great.
Great.
I have no idea if this is out of the blue, but do people ever make the other side leaflet, the working with interpreters for the patients? I don't know if there's research on that or if that's something that's done. I mean, I sit in the doctor's office and there are so many leaflets that you sit there and read while you're sitting there. To what extent is it also helpful, or do people practice helping educate the patient on working with interpreters?
That's me. There are leaflets. I didn't go extensively into that research, but I know that there definitely are, but there's much less, if any, for resident physicians. So, yeah.
No, I was going to say it was kind of bouncing off what Professor Woodard was saying. Everything we've learned for those in the ITS track with respect to the role of the interpreter, with respect to what we do need for not only the patient but the provider to understand for us to really do our jobs effectively. Like you said, I don't think this is something that would only apply to downtown health policy, because especially the three roles that you mentioned are, in every documented piece of research done on the role of an interpreter that I mentioned. So these are things that do apply for interpreters around the country, around the field, in different settings. And with respect to each of the points you pointed out, especially with speak directly to the patient and avoid using first and second person. I mean, me and Samantha, we use first and second person. Samantha and I did our internship at Community Care Center, another clinic, as medical interpreters, and these were problems we had every day. So, I mean, every single day, like every single session. So, I mean, even if this was just, I feel like this could apply to any clinic within North Carolina, I mean, at national region, but these are problems all interpreters go through, especially in the medical field.
Thank you.